morning, it's Viewpoint. This is Andy Devine substituting for the old fellow Bill Gossett. Bill's a little aging right now and ailing, so Andy Devine will substitute for him. And the girl who's going to carry the ball, like a great quarterback and line puncher, Judith K. Busby. Good morning, my dear.
Good morning to you. I'm sorry about that. Boy, I'll tell you, that's an occupational hazard when you've got no voice.
It'll get worse before it gets better.
Is your throat sore or just croaky?
Well, like I said in the car coming up, that great musical South Pacific, where the sailors are lamenting their conditions and so forth on this island in the South Pacific, and they say, "What don't we feel? We don't feel good." And that's the way it is.
Yeah.
So, you might remember, Doctor, that we always try to start Viewpoint with a kudo. Usually for somebody right in town, not necessarily. We've got some great things going on in our little communities around us, the Atlantas and the Emdens and the Elkharts and the Broadwells and Mount Pulaski. Don't forget Burtonview.
Yeah, International Airport.
Seriously, last night, maybe that's one of the reasons I'm so doggone tired, went down to Springfield Gym once again to welcome the honor flight home. Once again. Few people working hard to do a great job for a lot of old codgers. I was intrigued, and I say that, and I come to think about it, I went there. I must have been an old codger when I did that. I noted, naturally so now, with the progression of time, that there are more orange or yellow shirts, Korean veterans that went as opposed to those of us who wore the blue shirts. And but specifically, we have a family here in Lincoln, Aaron and Joyce Leisman and son Adam. They are down there faithfully every time. Adam has gone on all the flights, I think maybe all but one. They just do a whale of a job. And so on a local basis, as you know, that thing is kind of near and dear to my heart. I think it's a great cause, and the Leisman family always step to the plate, and they swing a good bat. So thanks to them. I mentioned my pontificate just a minute, if I may.
As long as your voice holds out, go ahead and pontificate.
This veteran business and so forth. You know, there's a program called Wounded Warriors. And I just wholeheartedly believe in that, folks. We're, due to medical science, as Doctor can attest, we're bringing back a lot of men and women that we would not have brought back before. Sometimes you have to ask yourself, why? We have some grievously burned veterans, horribly disfigured and so forth. Wounded Warriors is a great program, and I urge people out there to think about that. It doesn't take a whole lot. Their motto is try to get us $19 a month as an underwriting cost, which is really a pretty neat thing. So think about that.
Can I do one kudo-ish too, please and thank you?
Well, wait a minute. We have to talk about this. We didn't discuss that on the game plan coming in.
I'll be real quick.
Yes, go ahead.
I would just like to congratulate and thank Dr. Mary A. Helen, who is retiring as superintendent of District 27 now at the end of this year. And she's done a great service for our community, and she will be greatly missed. She's a fine superintendent and a fine lady.
Yes, I'm glad you brought that up, which brings another personal little point. You know, her husband Ray saw me doing contortions, bending over to pick the ball out of the cup on the green after putting out. And the next day I see Ray, he comes up to me, and he's got one of those little devices you put on the end of the putter with a sponge, and you just stick it down there. And he gave me that. Well, I thought the gesture was
thoughty.
The gesture of that was more appreciated than what I actually got.
Really, yeah.
It was really a neat thing, and
nice people.
It was a very nice thing to have done.
They've been an asset to our community.
Yeah, they have been. Now, I think it's probably appropriate we introduce our guest this morning, and then I'm going to sit back and rest while you carry the ball.
We have a really good guest, and she's here in a timely manner. We mentioned in the car on the way up. that Dr. Lynn Dennis, podiatrist exceptional, was telling us that now that summer is here and the people are wearing their thong sandals, and
going barefoot.
many of the ladies are wearing cute little shoes, with the exception of herself here. I do not wear cute little shoes.
Well, you don't have cute little feet, that's why.
I got ugly old feet. And therefore, people are experiencing heel trouble in the form of this plantar fasciitis.
That's correct.
Now, let's talk a little bit about our shoes and how the thong sandals, etc., can bring on the plantar fasciitis.
Well, basically, plantar fasciitis is a pulling of the arch. And when someone doesn't wear a supportive shoe, something that doesn't have a good arch support or a good heel counter, the foot starts to flatten. And as it flattens, it pulls on the band of tissue called the plantar fascia in the heel. And it rips and it pulls and it tears. People that have plantar fasciitis usually know it when they come in, because they'll say, I do pretty good when I'm laying down, but if I get up first few steps in the morning, I'm miserable. It takes me a few steps to get warmed up and get going. I do pretty good while I'm walking, but as soon as I sit down and get back up, I'm having trouble again.
Mm-hmm.
So they'll come in and we'll tell them, the first thing I'll look at their shoes, and most of the time they have a cute shoe or a flat shoe, and we'll talk about how shoe modifications a lot of times can correct this problem. I'll often recommend a New Balance tennis shoe, or if they want to wear sandals this time of year, more of a Birkenstock type of sandal that has an arch support in there.
Well, and those are kind of like molded, so
do
that they're
kinda
the
mold your feet.
shape.
Are they
of
good for your feet,
foot.
that type of footwear?
Yes. I mean, the Birkenstocks, if you're going to wear a sandal, they're going to be the best types of sandals that you have out there. No sandal is ever going to be as good as a good supportive tennis shoe or an SAS shoe, which is another brand of San Antonio shoe.
Mm-hmm.
So
So the kind of shoes you wear have a direct effect on how your foot is going to feel.
that is correct.
Uh-huh.
And if they choose not to, when they start feeling this pain, if they choose not to change their shoe styles, it becomes a chronic problem. They can't, it just starts to hurt all the time because there's a nerve there that gets impinged and pinched. And often they'll have to come in and we'll have to give them cortisone injections or anti-inflammatory medications. Sometimes we'll have to make them custom arch supports to go into their shoes to help relieve the problem. But if they would just simply change their shoes or get back into a more supportive shoe when it first started, a lot of times those types of problems could be prevented.
I kind of suspect, too, that the type of floor you work on
Yes.
makes a big difference to how your feet feel, and maybe your legs, too, for that matter.
Yes.
If you work on a concrete floor all day, it's kind of hard on your feet.
Yes. There's certain professions that I'll see more often. People that work, nurses that work in the hospital setting, people that work in factories, just with horrible pain. And unfortunately, those are the hardest individuals to get to calm down their foot pain because they have to go back to their occupation day after day after day.
Right. So it just keeps re-flaring.
It does, exactly.
Uh-huh.
I'd like to visit the term flat foot again. By the way, I wonder how that ever happened with detectives.
Oh.
I'll check into the origination of that. Seriously, no.
We digress.
You have people with flat feet, truly, so that no arch at all. Is that very difficult for them in their as they go about and get their aging?
Yes.
And the reason for that is?
When you have a flat foot, it unlocks the joints. It becomes a very unstable foot. And so those individuals are more prone to bunions, hammer toes, midfoot arthritis, ankle arthritis. And then if the foot isn't straight, then the knees go in.
And then your spine.
Yes, and then it just goes up the system. So those people with flat feet tend to have musculoskeletal problems all the way up their body.
Is that right? Now, you mentioned bunions. From whence do they come, and how come some people have pretty pronounced ones and some people get by without having them? Is it a birth defect, as it were?
Comes from a Southeast European country.
We do know that we genetically inherit our foot structure from our parents. So when you talk to people, if they have significant bunions, they'll always say, yeah, mother or grandmother had this type of problem. It has to do with the instability of the foot and the way the bones are moving and sliding. But some people have bunions and they don't really hurt. They're just big bumps that push out on their shoes. Other people have very little bunions, and the arthritis in that bunion joint is so painful that they have to have something done surgically to them.
Now, there's another subject altogether, this arthritis business.
Yes.
I didn't know you could have that in the top of your foot. I think of it as your fingers and those kind of, your elbow, your hip, your knee. But a lot of people that I've been talking to have said that their foot is just killing them.
Yes. There's a lot of joints in the foot, obviously, and especially the top of the foot, where the foot is the highest. We call it the keystone. As we age, it starts to fall, and because of that falling, it sets up an arthritic flare-up. Also, a lot of times people have sprained their foot in the past, and it goes undiagnosed, and it's actually an injury to the joints in that area. So.
And then here comes Arthur to just settle right in.
A lot of times a good arch support will help, though, because if you can stop those bones from moving too much and re-support them, some of that arthritis will feel better on the foot.
That would be helpful.
Yes.
Doctor?
And then the shoes help.
What is the most common foot ailment you see in your practice?
It really varies. I would say what I see most often are seniors who are having difficulty cutting their toenails, corns, or calluses because of limited hand strength. Usually
We
they
can't see them.
And you can't, and exactly, you can't see them or you can't get down to them.
Yeah.
So a large percentage of my population is what we call palliative, preventative care, just helping people feel better to stay active in their life.
Uh-huh.
And then we have the diabetic population. Everybody knows that the diabetes is skyrocketing. So we do a lot of diabetic preventative care, a lot of preventing ulcerations and infections from happening by just cutting diabetics' toenails, cutting their calluses, making sure that they're in proper shoes.
Mm-hmm.
And then the plantar fasciitis is probably my third most common.
Is it?
Mm-hmm.
Do we have anything that we can do to prevent that?
To prevent?
The plantar fasciitis?
The biggest thing is trying to stay active, stretch your calf muscles because it has to do with the tightness in the calf, and wearing the proper shoes. A pair of flip-flops, even though they're cute, they're not going to support your arch, and your arch is going to fall.
This shoe business, it really, in the final analysis, is a big deal, isn't it?
It is.
Yeah. Pretty shoes just aren't darn good, are they?
No.
Is
Not so much.
seeing younger people, I guess that's a kind of a dumb question, really. Well, I'm going to go ahead and ask it anyway.
Ask
what the
anyway.
heck?
That's okay. There's no such thing as a dumb question. Remember
Okay.
that?
Before
Is that one?
before I was so rudely interrupted. Young people in your practice, very few young people in your practice.
I do have young people in my practice. Mostly that age group are warts,
Surely.
yeah.
Yes.
warts, and ingrown infected toenails. So we call them paronychias, which they'll get ingrown, they'll get pus, they'll hurt like heck.
Really?
Yeah.
Now, what causes that?
It can either be a couple things. It can be improper trimming.
Uh-huh.
It can be bad pedicures if they're women in the regular age group that get pedicures. It can be genetics. You talk to them and they say mom or dad or grandpa had chronically ingrown toenails.
Uh-huh.
So there's ways to treat that too. We can treat it conservatively by just trimming out the nail when they can't do it. We can numb them up and clean out the corner. And we can actually kill that corner of the nail so that the problem stops happening over and over again.
Really? Well, that would be a boon to people who have an ouchie, wouldn't it?
It's a blessing. People don't realize that the procedure exists, and a lot of people have suffered for years and years with ingrown toenails.
Yeah.
And finally I'll say, we can fix this problem. And the joy on their face and
Yeah.
the relief of not having this chronic pain is amazing.
Yeah, my dad had that trouble, and oh my goodness.
How long does it average, well, how do you define average, I guess, but in between cuttings, for instance, on an adult?
An adult, about 8 weeks.
About eight?
8 to 12 weeks probably.
Is that right?
Yep.
Up to maybe 3 months. That's
Yeah.
interesting.
We've been talking about stability. I remember as a kid I was complaining about my ankles because they're not trim. And my dad said to me as a teenager, so it wasn't very comforting, he said, well, you mustn't complain about those ankles. They're good, stout, sturdy ankles. They'll never give out on you. Yeah. But is that an issue too? If you have nice, good, stout, sturdy ankles, does that help your feet be good, stout, and sturdy?
It prevents ankle sprains and instability. People tend to have ankle injuries, and it repetitively happens. So if you have good muscle stock around the ankle, yes, you'll be less likely to fall. And that's what we encourage our seniors to do. Stay active, stay walking, try to keep those muscles as strong as possible to limit the number of falls, because our senior population, that's what we're concerned about, is falling.
Falling. That's exactly right.
Doctor, will your practice take you into a hospital, into an operating theater to do surgery on somebody's toes or feet?
Yes, we can. Yes, we can do that. I'm more of a conservative doctor, so I will try to do everything basically in office, but I will do some surgical-based procedures, mainly toes that are crooked, like hammer toes, or a lot of times diabetic infections that need amputations have to go to the operating room. We try to prevent those, though.
I heard the other day that there was a new approach to things that they refer to as hammer toes. That's not quite the Chinese torture they used to do.
Just break it and stretch it out.
Yeah, I know, but
there's a couple different procedures that we do now compared to what we used to do. It used to be if someone had a hammer toe, I took them to the operating room and took out the piece of bone and put a metal wire through the tip of the toe that stayed in for 3 weeks and then had to come out. Now a lot of times what I'm starting to do is before that toe gets rigidly contracted, it'll be softly contracted. You'll be able to still move it. A lot of times we can cut that tendon on the bottom or the top of the foot in the office, and it will release that toe to become straight again, and they don't need to go to the operating room. There's also now internal implants that you can actually put into the toe that you pop into one side and the other side, and it internally holds the toe straight. So those pins with the balls on the top of them are no longer there. So that may be what you were thinking of.
Yeah, that would sound like a better approach.
It is. It's a quicker healing time. It's less pain, and the toes look nicer because they don't stay swollen as long.
Well, it doesn't matter whether they look nice or not if you're wearing the proper kind of shoes.
I had a friend that had one toe completely crossed over there. I don't know how in the world a man wore shoes. The toe was completely crossed over like that. Is that pretty common?
Pretty common. Not horribly common, but pretty common. I probably have about maybe 10 or 15 patients.
How would you wear shoes?
You'd get the extra depth shoes. The shoes are made, some are just regular and some are diabetic or extra depth. So he would wear an extra depth shoe. Sometimes those types of patients will actually pad around their toes to try to prevent them, because the joints will start to rub on each other and hurt. It's pretty uncomfortable, though.
You mentioned the word diabetes. Excuse me, please. It's an ad commercial. There's these health commercials on they'll return you off. They're gross, but about tingling. The bottom of your feet were tingling. There's a diabetic condition. To what does that allude?
That is called diabetic peripheral neuropathy, and basically what happens when you
Not in this studio.
When you have elevated blood sugars, it kills the nerves. And so what diabetic patients will start to feel is they'll feel burning, numbness, and tingling. And eventually, if it goes uncontrolled and untreated, it will progress could progress up to the knee. Really? And it will actually go into the hands. So that makes it an instability issue for our diabetic patients.
How do you treat that?
I have a friend who's having skin grafts. Maybe it's done now, but was having or is still having skin grafts on his toes.
From an infection?
And that's apparently trying to clear up these lesions as a result of diabetes.
That's correct.
That's pretty interesting. Yes. Matter of fact, it tells you how people can think out of the box medically. It's kind of a different subject here for the area this morning. Kids go outside and play. Seriously, somebody thought of taking the skin that they were throwing away from circumcisions.
Yes, that's correct.
And they process that, and they use it on for plastic
For
surgery.
skin grafts. And it works
What an
wonderfully.
interesting concept that somebody sitting back in the back said, "Hey, we're throwing that stuff away. Why don't we use it?"
And
I thought that was
it does
amazing.
heal the diabetic wounds.
Uh-huh.
It does heal them.
What can you do to help a diabetic before it gets to the point that you were talking about where they're having a numbness clear up to their knees and on into their hands and everything? What can be done? And then they lose one digit and the next. It's just, that's a most insidious disease.
It is. There is a new vitamin that has been used in Europe and Asia for probably 20 years called benphentamine, and it has been brought over to the United States and is marketed under the name Neuremedy, and it has to do with, basically a vitamin B component, and I have seen some success with our diabetic patients re-healing the nerves. We do a month of this vitamin, and about 50% of people will get some improvement with them. They will stop feeling that horrible burning, that numbness. But it takes a while because we're regenerating nerves. So they're saying it helps about 50% of people. The other 50% of people, unfortunately, the disease continues to progress until the fact that they're being treated with Neurontin or gabapentin through their medical doctor.
Judith K., we're going to have to run. Thank goodness we have good feet left to a commercial break. Then we're going to come right back. And our guest this morning is Dr. Lynn Dennis. It's certainly nice to have you with us this morning.
Thank you very much.